of 8,000, and we're pleased asking everybody to come forward, especially again as the winter months are approaching and people will be developing flu-like symptoms. Please assume you have the coronavirus. Don't assume it's just a cold and don't assume it's just the flu. We desperately need to maintain a high level of testing as restrictions are eased to make sure we identify as many cases as possible so that we don't have any of that community-to-community transmission, which unfortunately will cause the virus to spread. Now, as I've been saying for a number of weeks now, as we ease restrictions, there is no doubt the number of cases will increase, and we should measure our success by making sure we have a good level of economic activity or normality in our lives whilst a manageable rate of case numbers. And that is our objective, to get that balance right, but also to make sure we keep everybody as safe as possible, and in particular protect those most vulnerable in our community. I wanted to thank the Minister for Education. By all accounts, the first day back at school was very smooth, and I'll ask Minister Mitchell to give an update later. But today I also wanted to acknowledge the great work done by the Minister for Planning. We know during this time that keeping jobs and creating jobs is so critical, and Minister Stokes has overseen a process where he and his department identified 24 projects which were awaiting approval, and ensuring that no corners were cut, ensured that a number of those have gone through assessment. Some of those have been successful, and pleasingly today Minister Stokes will be outlining a project that was successful through that process, which will provide a $1.5 billion investment in Mount Druitt, 15,000 extra jobs, revitalising that CBD, and I'll ask Minister Stokes to explain that in greater detail. But this is an example of our government working hard during the pandemic to bring forward projects which not only will provide a really huge economic boost for our communities, in this case in Western Sydney, but also ensuring that we're creating those jobs and getting economic activity wherever possible. Today is also Nurses and Midwives Day, and we want to thank, it's actually Nurses Day. We want to thank International Nurses Day. We want to thank all of our nurses in our healthcare system, especially during this time, who are on high alert and ready to take on any patients they need to take care of. So in particular, I want to extend our deepest gratitude to all of our nurses, and especially to those who've come out of retirement and are getting retrained to be on standby should we need them. And we're deeply grateful on behalf of all of us for their efforts.